Hi friends, this is Dr. Abdequaem Chimthanawala. Today we'll discuss another very important remedy for cough which is used in our day-to-day practice, and the remedy is Coccus cacti. Coccus cacti, of course, in Mathemedica, if you see Coccus cacti, there are many of symptoms. Today we are not going to discuss the symptoms, but I'll today only discuss what symptoms I have found in my patient in my clinical practice that has given me very good results in prescribing Coccus cacti. The most important thing in Coccus cacti is one symptom that is very important, that is asthmatic troubles with kidney problems. Now this is a very interesting symptom, asthmatic troubles with kidney problems. So if this is a case with you, the patient is suffering from renal failure or Bright's disease or any kidney disease, simple UTI also, and it is with asthmatic complaints, do think about Coccus cacti, the first remedy, because Coccus cacti I have found invariably works very well if this symptom is present, along with a remedy which is again very useful like Coccus cacti, again rarely used and thought of in these complaints, and that is Squilla. Remember this remedy with kidney complaints, asthmatic troubles. Second, in Coccus cacti, the respiration is very difficult. There is very difficult respiration, which is the modality is important, which is ameliorated by forward bending. The patient bends forward and the respiration becomes better. This is again a very interesting and a very important symptom of Coccus cacti. Of course, there are few remedies which have the same symptom where the respiration, which is difficult, is better by bending forward. Coccus cacti, lachesis, spongia, calicar, calibicrom is also there, arsenic is also there. These remedies are also very important in these complaints. One symptom of Coccus cacti which I have found useful in many of patients is the modality of respiration. See, respiration is difficult, sitting ameliorates. Head bend forward on the knee ameliorates the complaints. See the length of the symptom which is written in a Mathemedica. Difficult respiration, sitting ameliorates, head bend forwards on the knees ameliorates the difficulty in respiration. Now this is again a very important symptom of Coccus cacti, but a remedy which is useful in this condition also is one remedy that is also very important, and normally we think about that remedy, and that is calicarb. Calicarb also has the same symptom, respiration difficult, better by sitting and putting the head forwards in between the knees or bending towards the knees, ameliorated complaints, Coccus cacti and calicarb. So when you feel that the patient is not calicarb, think about Coccus cacti if this is a classical modality. And in respiratory troubles, Coccus cacti has a very important symptom, that is gasping respiration. And then the cough starts. So whenever the patient tells you that डॉक्टर साहब मेरे इतनी तकलीफ होती थी सांस लेने में और उसके बाद मेरे को खांसी शुरू होती, do think about Coccus cacti. Gasping cough before respiration. Gasping cough, respiration में gasping cough before, that is important. Coccus cacti, bromium, bryon is also there. These are the very important remedies which will give you good results. And in one thing, in respiratory troubles, the breath of the patient is hot. Coccus cacti has hot breath. That is carbon sulfur is also there, Naxwamic is there, Rustox is there, sulfur is there, Sabadella is there, which has hot breath. Now these are the very important symptom of Coccus cacti respiration. As you go further in your practice, you will see many of symptoms of cough of Coccus cacti is also important, and very important symptom of Coccus cacti which is very similar to Drosera, barking cough. And whenever there is barking cough, you always think about Drosera, but my dear friends, do think about Coccus cacti, where it is a very peculiar modality like causticum. Two remedies are there, causticum and Coccus cacti, where there is barking cough, better by drinking cold water. When the patient comes to you, he carries a bottle with you, it's a bottle thermos, and he coughs in front of you, takes 2 or 3 sips of the cold water, and he feels, now I'm feeling better. Do think about Coccus cacti and do think about causticum. These are very interesting and very important remedies in our Mathemedica. And one thing, cough A Coccus cacti patient will say, जब भी मैं नाश्ता करता हूँ, whenever I have breakfast, I feel better. This is again a very unique modality which is only unique to homeopathy, you know. The patient says that he is better after breakfast or ameliorated after breakfast. Think about Coccus cacti or Kalikar, Black Asses, Bratakaram. These remedies are having the same modality, better by breakfast. Now this is a very unique modality and that has to be, that's why read properly. खाना खाने के बाद, कब खाना सवेरे, and that is breakfast. So this is a very important modality again of Coccus cacti. And cough. Now Coccus cacti, though it has loose cough, lot of mucus, lot of this is normal. But I have seen cases of Coccus cacti when when you talk loudly, you know, the cough starts. अगर पेशेंट ने जो हाई पिच पे बात किया, बहुत ज्यादा खांसी शुरू हो जाती, दैट इज अ वेरी अगेन इंपॉर्टेंट सिम्टम ऑफ Coccus cacti. Cough on talking loud. In this modality, in this symptom, you have Coccus cacti, phosphorus, again a very important remedy, tuberculinum, ambragrasia, argentum nitricum, where the cough is loud on talking. Now this is important because whenever the patient comes to you and says, he talks very softly in front of him, he says, you tell him कि थोड़ा जम से बोलिए, speak loudly. He said, no, I cannot speak loudly because the cough starts. If this is the symptom, the patient did not need to tell you, to understand the symptom and then have at least 4 or 5 remedies so that you know exactly which remedy is required for the patient. Now expectoration. Now expectoration of Coccus cacti, you will have a lot of expectoration, like we have greenish expectoration, grayish expectoration, white albuminous expectoration, yellow expectoration. Sometimes it is difficult, sometimes easy expectoration. But I have seen one thing in Coccus cacti, the expectoration are in shape of balls, you know, balls. Balls like expectoration is a very, very important symptom of Coccus cacti. It comes like balls. Sternum metallicum, silicia and argentum nitricum also have the same type of expectoration. It comes in balls. And in Coccus cacti, remember the expectoration is easy in daytime, easy in the morning. Patient बोला जब भी मैं खांसता हूँ ना सवेरे पूरे कफ बाहर निकल जाता है. Silicia, Coccus cacti, digitalis, Orindo. These are the remedies which have easy expectoration, especially in the morning. Of course, the type of expectoration I told you everything, plus you can have gelatinous expectoration, lumpy, and sometime I told you something expectoration like balls. Sometimes it's called expectoration like masses. अच्छा बोलते हैं ना कि मांस के टुकड़े का सामान निकल रहा है कुछ बाहर, तो expectoration masses also you can think about basilinum, Kali nitricum, especially in bacillum, you know, if you are treating a case of lung cancer and all, and the expectoration like masses, think about bacillinum. Okay, so these are very, very important indication of Coccus cacti. Now, as you go, the expectoration is, as I told you, it can be thick, it can be viscid, it can be tough, it can taste salty. But one thing of expectoration that you should remember, that expectoration nauseates. This is the expectoration, the quality of expectoration that you have to remember in a Coccus cacti patient. It nauseates. So these are, or you can say, expectoration tastes nauseous. Now this, of course, there are a lot of other remedies like you have pulsatilla, sternum metallicum, ipecac, drosera, arsenic also. But I have found that in Coccus cacti, this is very useful symptom of Coccus cacti. So my dear friends, this is short version of Coccus cacti, what I have seen in my daily practice, in my years of experience of practice, and that has given me very good results. So if you like this video, do share and subscribe. Thank you.